everyone. Welcome to today's Pet Pawcast. I'm your host, Dr. Roberta Westbrook, and you're here with us at the Campus for All Animals, the Houston SPCA. It's August, and August is National Immunization Awareness Month. So what is an immunization? It's really just a long term for a vaccination to prevent infectious diseases. Well, I'm here today to tell you all about why vaccinations are important for your pet, which ones you need, which ones your pet may not need, and help to answer your questions. So if you have those, please get them ready and put them in the chat, and hopefully we can help you today. In the meantime, I want to introduce you to our pet of the week this week. Peter is such a wonderful pet. He's going to make a wonderful family pet. He's a 4-year-old male, neutered German Shepherd mix, and he's so sweet. He knows how to sit, as you can see. He knows how to stay. He knows how to shake hands. He's so sweet, and he knows how to lie down. Look at
right on cue. Yay, Peter.
What a smart boy he is. So if you are looking for a dog like Peter who can obey commands and be a wonderful pet for you, please come on down to our adoption center and see Peter and all these other pets that we have available for adoption. Peter's adoption fee right now is only $10. $10 because Peter is a VIP, a very important pup, and all of our large breed dogs are very important pups. So you're able to adopt them at an affordable rate and find them their home. Thank you so much for joining us. So let's talk about immunization awareness and how important it is to get your pets those vaccines. I know it can be confusing, so let's just start with the basics. Let's start with a dog. If you have a dog and you want your dog to get vaccines, you should know that there are 2 categories of vaccines available for your dog. The first category is called core vaccines. Core vaccines are the ones that your veterinarian and all veterinarians will recommend for all dogs, no matter the age or the lifestyle. Core vaccines include rabies. The rabies vaccine is required by law. That's a core vaccine. And the second core vaccine is what you might hear termed as the distemper parvo combo, or you may just hear it be called the distemper vaccine. There's a couple of other terms, DAP, and these vaccines are your core vaccines. They help to prevent about 5 different diseases that your pet can get that can cause them to be ill. So if you're wondering which vaccines your dog should get, rabies, your dog should get by the age of 12 weeks. So at 12 weeks old, your veterinarian will recommend your dog to get rabies. And the other vaccine, the distemper combo vaccine, we usually start vaccinating dogs around 6 to 8 weeks. So those would be some vaccines that your dog needs. Now, the core vaccines for cats are similar. Rabies is also a core vaccine required by law for cats. And the other one is also, we tend to use the term feline distemper vaccination. And so although it prevents different diseases in the dogs, it's the same in the sense that it prevents against a variety of diseases. And so both dogs and cats need rabies, and both of them need a canine distemper combo and a feline distemper combo vaccine as the core vaccinations. When you hear the term non-core vaccinations are those vaccinations that your veterinarian might recommend based on your pet's lifestyle. So if your pet has a unique lifestyle where maybe your pet goes to a boarding facility often or gets groomed often or is around other pets often, there are other vaccinations that are going to be important to prevent infectious diseases when animals are in large groups. And so those you might hear for dogs are going to be things like the Bordetella vaccine to prevent kennel cough. Kennel cough is a very common disease that dogs get when they're around other dogs. It usually causes a mild cough. Typically, the dogs are still active and alert and can live a happy life while they have kennel cough, but oftentimes it does require some treatment. So Bordetella, the kennel cough vaccine, is considered a non-core vaccine. For cats, there's a vaccination called feline leukemia vaccine. Feline leukemia is a disease that is transmitted between cats, and unfortunately, feline leukemia does not have a cure. It's actually a viral disease that is incurable. Now, you may not require this vaccine if your cat is maybe in a single cat household and doesn't interact with other cats. But if your cat goes indoors and outdoors, or if your cat goes to get groomed, or your cat goes to a facility where all the cats get to play together, the feline vaccine might be necessary for you. So those are some examples of core vaccines in dogs, core vaccines in cats, and then non-core vaccine in each species. Do you guys have any questions about what vaccines your pet may need?
Caitlin wanted to know how often, like they say you need it, but how often if your veterinarian isn't good at keeping track of that for you?
The frequency of vaccination is a great topic to discuss because it depends on your pet's age and how many vaccines we feel like your pet has had in his or her past. For example, when you have a puppy or a kitten, puppies and kittens need frequent repeated vaccinations. And that's because what we want is we want your puppy or your kitten to develop his or her own antibodies against diseases. When puppies and kittens are young and they nurse on their mother, they will get antibodies through the colostrum, through the milk of the mother. But as they wean themselves off of the colostrum and the milk, now it's time for those puppies and kittens for their immune system to develop their own antibodies. And in order to help them do that, we vaccinate them. So when you have a puppy or kitten, we usually start vaccinating no earlier than 6 weeks, and we will give vaccinations approximately every 2 to 4 weeks until your pet is about 16 weeks old. So starting at 6 weeks and going all the way till about 16 weeks of age, your pet will get vaccinated every 2 to 4 weeks. Your veterinarian will tell you what schedule your pet should be on, but that's in general how frequently. Once your pet becomes an adult, then we typically vaccinate either every year, every 1 year, or every 3 years. And again, this may depend on what your veterinarian recommends for your pet. So every year vaccines or annual vaccines are probably the most common, but it is possible that as your pet gets older, your veterinarian may say the risk of these diseases is low, and I recommend that your pet only be vaccinated every 3 years. So talk to your family veterinarian, decide which schedule is best for you. But in general, younger pets are vaccinated more frequently.
Are there any vaccinations that are required by law?
Yes, so the one vaccination that's required by law is the rabies vaccine. So please make sure that you always keep your pets current on the rabies vaccine. And again, in terms of frequency, the first time your pet gets a rabies vaccine is usually between 12 and 16 weeks of age, and then every year after that. There is a possibility that your pet can be approved for a 3-year rabies, and that means that they only are vaccinated every 3 years. Just talk to your family veterinarian about which rabies vaccine your pet is getting and how long it's going to be good for.
How safe really are pet vaccines? Some people think they cause cancer or side effects later.
In general, pet vaccines are extremely safe, and the risk of adverse reactions is very low. But the most common reactions that we see after a pet gets vaccinated is soreness at the site of injection because they've just gotten a shot, and lethargy. So as the immune system gets stimulated, sometimes it can make your pet be a little bit sleepy. That usually only lasts for 24 to 48 hours, and they're back to normal after that. Some pets don't have any adverse reactions at all, but in general, they're very safe. Occasionally, we may have a pet that has an adverse reaction that is more severe, where they begin to have symptoms such as vomiting or diarrhea or extreme weakness. In those cases, we want you to bring your pet to your veterinarian right away so that we can provide treatment to help your pet recover from that adverse reaction. Those are uncommon, but can occur in some animals that have a sensitivity to vaccinations.
Is it safe, say you rescued a dog and he was a senior pet, say 10, 12, 13 years old. Is it safe for an older pet to get a vaccine if you don't know what their history is?
Yes, that's a great question. So even if you have an older pet, your veterinarian may still recommend that your pet get at least 2 vaccinations. So they may get 1 vaccination and then get a booster 3 to 4 weeks later, And then after that, it could be annually or every 3 years. It's still safe for geriatric animals to get vaccinated. Although the risk of infectious disease at that age is lower, when we don't know what their immune system is like and we don't know what exposure they have, it's still best to make sure that they have that protection rather than not have it.
What are your thoughts on vaccinating your own pet by buying those vaccinations, say like at a feeder store?
Sure, there certainly are some clients who want to vaccinate their own pet. Please just make sure that if you are vaccinating your own pet, that you do it under the guidance of a veterinarian to make sure you're giving the appropriate vaccines. But also you want to make sure that those vaccines are going to be recognized by the veterinarian that you're going to. So there are some veterinary hospitals who may not recognize as valid vaccinations that were given by the owner. And some of that has to do with not being sure how the vaccinations were stored, whether or not they were given appropriately. And so you want to check with your veterinarian to make sure that your vaccinations are going to be recognized as valid if you give them yourself. We want to make sure that vaccines are always stored in a refrigerated container. Once they reach room temperature, they are not useful or valid after they sit out for a period of time. So you always want to make sure that they're refrigerated. And we always want to make sure that who's ever giving the vaccines gives them in the right method and in the right way. So please talk to your family veterinarian about it, but given in the appropriate manner and with the vaccines stored at the appropriate temperature, giving your own vaccines is absolutely something that you could do well.
So our sweet little pet of the week, Peter here, has just completed his heartworm treatment. On that topic, is it safe for pets to be vaccinated if they're in the middle of heartworm treatment?
Yes, that's a great question. So in general, what your veterinarian may do is make sure that your pet is current on the basic core vaccines first before starting the actual treatment. Heartworm treatment is a process and it takes several months to complete from beginning to end. So it's usually pretty common that your pet is going to get their core vaccines first and then work on that heartworm treatment process, since the heartworm treatment process takes several months to complete.
Is it possible that an animal could get over-vaccinated?
That's always a great question. Oftentimes clients don't want to over-vaccinate their pets and they may be concerned about the side effects. And so, we don't really know what obvious side effects will happen if a pet is what we call over-vaccinated. For example, we see a lot of lost and abandoned stray animals here, and we don't know their vaccine history. We don't know whether they've received a vaccine in the last week or two, or if they haven't had vaccines for years. In general, the medical community agrees that it's better to go ahead and proceed with those vaccines to ensure that their immune system is going to be protected than to be concerned about possible adverse reactions. As I mentioned before, adverse reactions are so few and actually very mild that it's better to err on the side of protection than on the side of not vaccinating the pet.
If I use a low-cost clinic, do I still need to visit a full-service veterinarian?
Sure, that's an interesting question. So you may go to one clinic for your vaccines every year, but every vaccine clinic may not be what we call full service. So they may not provide service for sick or injured animals. And so you can get your vaccines at one location, but if your pet becomes sick or injured, you may have to go to a full service veterinary hospital for that continued care. So it's completely up to you if you would like to get your pet's vaccines at one place and then get all of the medical issues addressed at a full service clinic, or if you just want to take your pet to a full service clinic and get everything done at the same location. Both are okay, and whatever works best for you and your pet is perfectly fine.
So in terms of grooming and boarding, and I guess it depends on the service. Do you know why that some require the canine influenza and some don't?
Yes, it does just depend on the business. So canine influenza is a respiratory virus that can cause pretty severe respiratory symptoms and in some cases death. But every organization and every facility can create and develop their own requirements for pets that come there for boarding and grooming. So you are welcome to contact each boarding or grooming facility that you're considering taking your pet to. Ask them what their requirements are, because not only do you want to know if your pet needs those vaccines, but you want to know if the other pets in that facility are going to be vaccinated as well. And so it does just depend on the facility and what they feel like is most important for their environment. Canine influenza has outbreaks. There are some areas in the United States that have had outbreaks. The Houston area is not one of those areas yet, and so there may be places that don't feel like it's a required vaccine at this time.
And you mentioned the strays and the unknown animals that come into our care. What about those who kind of do some rescuing in their neighborhood of animals? Is it a good idea to keep a found pet in the backyard away from your owned pets until you can get them to the vet?
Yes, if you have found a pet and you're unsure of that pet's vaccine history, it's always safest to keep the found pet separate from your pets until they've been cleared by a veterinarian and been properly vaccinated. There's generally about a 2-week time period between a pet coming in contact with a bacteria or virus and actually showing symptoms of that disease. So if you find a pet today, and maybe they came into contact with something yesterday, you may not know it. It may take 2 weeks for that to show up. Well, during that 2-week period, you don't want that pet to interact with your pets because you don't want any transference of infectious disease. So it's always a good idea to do what we call a 2-week quarantine period of any new pets with your current resident pets until they're cleared from a veterinarian, by a veterinarian, and received proper vaccinations.
And if they haven't had their vaccination, say you found a dog and you want to bring them to a vet to have them checked out, things like writing in your car, if you were to bring them in their house, is there anything that you need to be concerned as far as like wiping things down? Like how contagious could they be?
Yes, great question. And it depends. So if you're bringing a new pet with unknown vaccine history and carrying unknown diseases, you have them in your home, I would say limit their exposure to your home if you can keep them in an isolated area, maybe one bathroom, one bedroom, or in a crate, so that in the worst case scenario that they do have a contagious disease, that now they haven't been on your couch and your bed and outside, and now your other pets are at risk. Again, for that 2-week period, limit their movement around the house, keep them in a confined space, because some of these diseases are very contagious. For example, some of them are spread through the air. They're aerosolized, very much like the flu or other respiratory viruses. So as a dog coughs or sneezes or even breathes, sometimes those little virus particles can travel throughout the air and affect your pet. Other diseases are transmitted through the feces. And so some of those bacteria and viruses can be excreted in a pet's feces. If your pet comes into contact with that, particularly if they ingest a portion of that, that's how the disease can be transmitted. So again, limiting exposure to the new pet, to your current resident pets, and not allowing your pet to have full range of the house in that early phase would probably be the safest. I know it's difficult because you're going to want to integrate them into your family quickly, but you also want to make sure everyone stays safe. Well, I would say this month, please contact your veterinarian if you have any questions about your pet's vaccines, their vaccine schedule, or their vaccine history. There's so much that we can talk about regarding vaccines, but it's so important to make sure that prevention is what we focus on. Preventing these diseases is going to be much better than trying to treat them once your pet has them. So always make sure that you schedule a veterinary visit for your pet at least annually to make sure that they are healthy and that they've got all of their immunizations. We thank you so much, and I want to remind you that this month is Clear the Shelters Month. What that means is every August we want all of the animal shelters and rescue groups to find homes for the pets in their care. So we need you in the community to come on down, considering adopting a pet, and take a pet into your home. This August 26th, this month, is Clear the Shelters event here at the Houston SPCA. It's gonna be a wonderful family affair. We're gonna have snacks, we're gonna have drinks, we're gonna have activities, we're gonna have demonstrations for you and the family and the kids. So please make August 26th a date that you plan to come to the Houston SPCA. We're open from 11 a.m. to 6 p.m. and we're gonna be happy to have you and have a wonderful time with you. Come on down every day, 11 a.m. to 6 p.m. and see all the pets that we have available for adoption and get your pets vaccinated this month. We will see you next week here on the Pet Podcast. I'm your host, Dr. Roberta Westbrook, and we'll see you next week. Bye, Peter.